you should talk to someone. Well, who should you talk to? Let's talk about the different types of mental wellness providers. So, I'm Kathy Schwarman. I am a licensed clinical professional counselor, a trauma expert, and a certified neuro-linguistics programming practitioner, and the owner of Monarch Therapies. We would love for you to visit our website, and we can connect you with the right type of mental health provider to serve your needs. So let's get into it. There's so many types of providers out there, and I get a lot of questions on who should I see? Well, let's start with the difference between a coach and a counselor. So there are a lot of great coaches and a lot of great counselors out there. Coaches are folks that have gone through a certification program. They might be certified in financial coaching. They might be certified in neuro-linguistics programming coaching. They might be certified in life coaching, business coaching. They've gone through a certification process, and their goals are your goals. They're there to help you look at what do you want to achieve, help you develop the plan, and keep you accountable to that plan. Then there's counselors. Counselors, well, there's counselors, there's like I am a licensed clinical professional counselor, there's licensed clinical social workers, there's licensed marriage or family therapists, um, lots of initials. Uh, Quick and dirty breakdown, we all provide therapy. It's how we are trained is a little bit different. We all have state-required licensing, which include clinical supervision anywhere. So each state has different requirements, but everyone has a master's degree and is required to do anywhere from 1,500 to 3,000 hours of clinical supervision before they are fully licensed. Social workers, licensed clinical social workers, have the background of a social work aspect, a systems aspect, and then the clinical aspect. Counseling, counselors, their master's program was mostly focused on the clinical piece, the mechanics of the counseling experience, and the theory around it. Licensed marriage and family therapists, as it says in their title, their clinical focus is working within those areas. So let's now talk about other types of providers. We've got behavioral analysts. Behavioral analysts are typically found in the treatment of people on the autism spectrum. You might have heard of ABA therapy, and they can also be very powerful advocates and behavioral specialists if you have something specific to work on. I'm going to give a shout out to one of my favorite behavioral analysts, Ashley with Mothership Wellness. She is a powerhouse of a behavioral analyst who focuses on nutrition and wellness for women over 40. And check her out. She's incredible. And let's talk about the next type of provider, psychologists. Now, psychologists do provide therapy. The main difference between a psychologist and a therapist would be they have their doctorate. They have a PhD or a PsyD. And a lot of psychologists also can provide psychological testing. So if you're looking to have your child or yourself tested for autism or ADHD or personality or just a more in-depth diagnostic, they are clinically trained in psychological testing also. And then there's psychiatrists and psychiatric nurse practitioners. Now, they are the physicians and nurse practitioners that can prescribe psychiatric medications. And so they can provide therapy also, but often they don't. We have a huge shortage of psychiatric prescribers, especially in the United States. And so most of your experience will be meeting with them for about 15 minutes, going over your symptoms, your medications, how that's going, and then prescribing accordingly. Uh, so that's a brief overview of all the different types of providers. If you have any questions or you're not sure who would be the best fit for you, reach out to us at Monarch Therapies. Go to our website, send us a message. We would love to help you navigate that. And again, I'm Kathy Shorman. I am the owner of Monarch Therapies, and I see you. I love it. I'll talk to you later.